And good evening, everybody. That's right, it's Sunday night again. So my name is Mike Sevilla. I am now president of the Ohio Academy of Family Physicians. I know, how did that happen? I have no idea. So we have an exciting guest coming up in just a few minutes, but I just have a couple of announcements. First, I just want to thank everybody just for all your well wishes and support during and following, I guess, my inauguration or swearing in last week at this time to be president of the Academy. It means so much to me to see everyone and all the text messages and all the messages. So thank you so much for that. And, you know, there were some, I tried to post some of the things this week. You know, I did issue kind of like a pseudo challenge during my speech to have people, you know, wear their masks and put it on social media. And a lot of OAFP leaders did that. And a lot of other people did too. So thank you so much for that. So a couple of other announcements here. So the OAFP does have a great CME coming up in September 30th. And the title is Building Cultural Intelligence to Break Down Racism. It is a virtual program. It is from noon to 5 p.m. on September 30th. Registration is open, and you can get information there at ohioafp.org. And also, we still have merchandise. We have the merch for our OAFP Foundation. All the proceeds go to the OAFP Foundation. So we have our doctor's orders shirts with the cool logo that have the mask, and it says mask +6, wear your mask plus be 6 feet away. Let's see, be a family physician mug and a tote bag, and maybe some other merch that's coming up in the near future. And again, all of the proceeds go to the OAFP Foundation. And thanks again to everybody who participated in the virtual family medicine party and raised a lot of money that evening for the foundation. So, all right. So now they got that out of the way, I'd like to bring in our guest. You know, Kyle and I have been friends for a long time, and been really interesting seeing his career and seeing his advocacy for this topic. But he is the author of this book right here, Fallible, a memoir of a young physician's struggle with mental illness. My guest is Dr. Kyle Bradford Jones. Welcome, Kyle.
Hey, Mike. Thanks. I'm happy to be here.
So we have a lot to get to tonight. But just to kind of start out, I tell all the students that I work with, and probably you too, Kyle, is just remember where you came from. So just kind of weave us along, just tell us where you came from and kind of how you found your way to family medicine in the first place.
Yeah, so I grew up in Farmington, Utah, which is like 20 minutes north of Salt Lake City. Kind of a distant suburb. Grew up with kind of the typical nuclear family. Mom and dad, I'm the youngest of 3 kids. And, you know, had a great childhood, played Little League, all the good stuff. You know, as I've kind of reflected on it, it was interesting because both of my parents have college educations. We were kind of upper middle class growing up, but no one in my family had ever been a physician. And so even the concept of that, or the idea that I could do that, was still somewhat foreign. You know, I know lots of people in different circumstances face that, but even in my experience, I had that thought. And so when I was in high school, my mother was diagnosed with breast cancer. And as we all know, she went through multiple physicians, multiple specialists, and she met with oncologists and surgeons and her primary care physician, etc. And it really made an impression on me that I could tell exactly what type of experience she had with that physician based on how she felt when she came home. Now, it wasn't that, you know, some of the physicians would downplay it, or some of them would make it much more harsh, but it was just the way in which they communicated and the way in which they approached her care. And, you know, I didn't meet any of the physicians, but just seeing its impact on her made a huge impact on me. And so I so around that time, I decided, maybe I do want to become a physician. I went to Utah State University, which is in the northeastern corner of the state, and ended up going to the Medical College of Wisconsin. And as we all know, medical students, and we're all over the place in terms of what specialty we want. And I was no different. I had completely committed in my mind to probably 5 or 6 different specialties. And, but in the end, it was kind of that notion of the experience my mother had with those physicians that really kind of led me to family medicine.
Wow.
Because I wanted that experience, and I wanted to be able to be one of those physicians that could have a positive impact on my patient, even though, it may be a hard diagnosis, it may be something that we can't fully deal with, but having that relationship and that impact was very important to me.
Wow. And that probably guides, kind of your work today. We'll get to what you're doing these days, but I mean, that had to have a really powerful impression on you early on to kind of select this career choice.
Absolutely. And, thankfully everything turned out fine. My mother's still around and, has been cancer-free for years. But still just being able, and, thinking back on it, I feel like it's one of those things where medical students or physicians, we choose our specialty based on what we've seen on our rotations or, with the physicians that we work with. And very few of us have that opportunity to see it from the opposite side. And so, having that perspective and then melding that with what I experienced in medical school, it's just kind of seemed like the biggest, most natural fit for me.
Cool. Now, I've been told to say where you work is the U, but for the people outside of the state of Utah, tell us about your job, your current situation, your work situation, et cetera.
So I'm a faculty member at the University of Utah School of Medicine. And you're right, if you're in Utah, it's the U, but I recognize across the country there are multiple the U's. I'm an associate professor in family and preventive medicine. And so I see patients, I teach residents, I do some research, I have some admin roles. So I'm kind of all over the place. But one thing that really, I think has made the biggest impact on me is the clinic I work in is exclusively for individuals with a developmental disability. And so I run the primary care team, and then we have psychiatry and case managers and therapy. And so you have not just co-located services, but you have integrated services. We really are a team that works all together for the patient. But also the most unique thing about it is that we are a Medicaid HMO, which basically means we become both the payer as well as the care provider. And so any typical claims that they would have through an insurance goes through us. And so, we still follow Medicaid guidelines, but then at the same time, if we need to be a little flexible with some of those things, we can do that, which is pretty awesome. And obviously that's one of our biggest frustrations as physicians and in general and in primary care specifically. But being able to have that flexibility to do things that are right for your patient, I mean, that's huge.
Exactly.
Especially with a population that struggles so much with health disparities and physical and behavioral health and whatnot.
And it's just, I mean, I know that we are going to get to it in your book, especially about medical education and things. And but share a little bit about what's it like to work with a residency program, medical education in general.
It's pretty awesome. It's one of those things where for a while, like I was doing some medical student education, but it was mostly didactics and lectures and I thought, I don't know how I feel about this. It just wasn't speaking to me the same way. When I work with residents, it's almost always clinical teaching in clinic with them. And, it's so great to be able to not only provide that perspective and that teaching to them, but I do learn a lot from them because, they are fresh off different rotations with certain specialties or whatnot. And so, they can tell me, hey, in ENT, they're doing this now, or, the dermatologist told me about this and I read this paper, and, so I'm learning a lot from them, which is great. It has been interesting in the days of COVID because I think, like so many of us, so many of the visits are virtual now, where, we still have some patients coming into the clinic when they need to, but I think that has been both very good and very hard on the faculty and the residents, because all of a sudden we are teaching and practicing and learning in a completely different environment that we haven't experienced yet, which in the end I think will be a good thing. But in the meantime, as so many of us are experiencing, has been a little difficult. Right. But and so sometimes I feel bad for the interns that are joining this weird world, and will be trained in a way that is so different from the way all the rest of us have been trained. But actually, along those lines, we have one of our new interns, Lauren Yater, is worked with you very closely for the last few years.
We said we weren't going to talk about this because I'm very bitter that you stole her from Ohio. But go ahead.
I'll bet you are. But she's awesome, and we just kind of serendipitously put the pieces together recently that we have you in common, that we both know Mike so well. So we're good to have her, and you prepped her and trained her well. So you did a lot of the work already for us.
Oh no, I mean she's very talented. I didn't really have to do much. She rotated in my office and asked a lot of good questions. And she's, as you know already, she has a passion for her work. And I'll be really curious on how her career evolves as well. So let's see what else I was going to say. Oh, so the clinic that you work in, I mean, it's just what kind of drew you towards that work? Because that's a very specialized population. Like you said, I mean, they need a lot more time and care. And what draws you to that type of work, working with that population?
It's kind of funny because I never saw myself doing that, and I never kind of intentionally looked for it. It was something that kind of fell into my lap. I've always been very interested in health policy and how all the pieces work. And when I was a third-year resident and started looking for jobs, the faculty member we had who worked there said, "Hey, I know you're interested in academic medicine. Come check this out. I'm looking for a partner to build up the primary care team. So come do a rotation with us, see what you think." So from a health policy standpoint, I was like ecstatic. I was like, this is so cool, and it's so different, and there's got to be so many things that we can learn and spread out to other areas because of how this is set up, and with both the clinical model and the payment model, et cetera. And so it was really just kind of the structure of the clinic that drew me in. And now it turns out that the faculty member there was not looking for a partner, but for a replacement. And so, but it was great. And, since then, like, I love this population. It's so great. And, it offers unique challenges and things. And I feel like, in some ways I've had to give up part of my training in that, I don't do OB, I don't do that many procedures because of the nature of the population, but I've learned so much else to focus on them. And it's really been great. So my 5-year-old daughter, the other day I realized, had stolen this Special Olympics medal from my office that one of my patients gave me. And so, like, it was a great thing. And like, that was a huge thing to me. And thankfully we got it back, but still it kind of made me think more on that. And just little things like that are just awesome. I love it.
My guest is Dr. Kyle Bradford Jones, author of the book Fallible, a memoir of a young physician's struggle with mental illness. And Kyle, so I'd like to dive a little bit in the book, but I'd like to kind of back up a little bit and maybe share about how you came about to start writing in the first place. I've read a lot about, and I've heard a lot of podcasts you've been on. You are a writer. You've been writing for a long time. And from what I understand, was it when you were writing for AAFP when you started to share some of your story there?
Yeah. So I've always enjoyed writing. It's always been kind of a great outlet for me. But also, I kind of have used it as part of my education, in that, hey, I'm really interested in this. I'm going to write an article about that because that will force me to learn a lot more of the nuance on whatever the topic is. But shortly after finishing residency, I blogged for the AAFP for a few years as a new physician member of the academy. And kind of during that process, you write roughly once a month or every other month. And so, I'm always thinking of ideas or different things that I want to explore. And it kind of slowly dawned on me that, maybe I should be talking about my experiences a little bit more. And because so many of us as physicians are dealing with it in one way or another. And, maybe it wasn't as bad as I experienced, but, you're still somewhere on the continuum of the stress of being a physician and going through medical training. And so I thought, I think I need to do this. And so it was just kind of a short blog post. There wasn't a lot to it, but wrote about my experiences of having severe anxiety and depression, and just had a great response from it. A number of people commented on how much it helped them to recognize that they weren't alone, that they were doing okay by experiencing and feeling those emotions. And sometimes that is, like G.I. Joe would say, that's half the battle. Like right there, just understanding you're not alone, that's a big deal. And so from there, I kind of started sharing a little bit more. My wife and I did a podcast together.
Yeah, I remember that.
Yeah, probably 2016 or so, where we talked about it, and she shared her perspective as a spouse of someone with these issues. And it was after that, the host, who was a friend of my wife's, said, yeah, you guys should write a book. And I thought, I've always wanted to write a book. I just never knew what I would write about. And my wife, Becky, wasn't that interested in writing a book. And so she said, well, why don't you write one? And maybe just share your story. And so from that point on, I started working at it. And here we are.
Yeah. I mean, it's just, so it's, I guess going back to when you were first writing about it, I mean, is it something, obviously you wanted to share your story, but, what did you think the effect would be when you would share your story? Would you just be like, hey, there's just a guy, it doesn't happen that often. And Kyle is just somebody who just went through a tough time, and it's not really resonating with other physicians.
Yeah. My biggest worry was actually people would either see it or read it and be like, he's a physician, like he's fine. He's got a good job. He makes decent money. Like, I don't want to hear about his struggles. And there has been that stigma in the general population, but even stronger in the medical world, about what we experience, not only as physicians, but as all healthcare workers, of how we face the stresses of working in medicine and going through training to become a physician. And so, I knew there would always be some physicians who would be like, well, you know, it's not a big deal, or back in my day, it was so much worse. And I fully acknowledge that. That's, you know, I can't imagine what physicians went through in their training many years ago. But I also know that it's not only a big problem, it's a growing problem in terms of physicians who suffer with mental illness. And so that was kind of my main idea, is that, hey, I need people to understand that they're not alone. And, you know, it's hard writing a book like this because I feel like all of my inner demons and secrets and shames and fears are all in there. And so, you know, I have completely bore my soul, but I did it so that people could understand. And whether they see it in themselves or they see it in loved ones, and whether they're not even in the medical profession, I still think it resonates. And I've heard a lot of people who have read it say, you know, I understood my daughter's problem so much more, or, you know, my uncle suffered with it, and now I understand kind of why he behaved some of the ways he did, or whatever it is. And so even for those not in the medical profession, it really has had a big impact of helping people understand mental illness and what that's like, and how they can work with loved ones or friends or whoever who may be suffering from that.
And we kind of talked about it before, but we kind of didn't talk about it before, you know, about reading something from the book. And
Sure.
I know you sent me some things. I think, and when I've been listening to you on other podcasts, people who are not physicians, it's interesting hearing their response to, you know, kind of like the pimping process, or
Mm-hmm.
kind of the medical training process. I think you
Yeah.
sent me an excerpt,
Yes.
because it reflects on your love of baseball as well.
Yes.
Why don't you read a little bit from this section of the book? This is let me just set it up here. So this is Kyle Bradford Jones reading from his book Fallible, a memoir of a young physician's struggle with mental illness, and then you'll get a little taste of the book.
Major League Baseball Hall of Fame umpire Bill Clem grew weary of all the insults he constantly heard. As he aged, he suffered from a skin condition on his hands that he was convinced resulted from the immense anxiety and tension he faced every day in his interactions with fans, players, and managers. Unlike many umpires in the early days of professional baseball, he avoided over-drinking to assuage his anxiety. Most baseball fans, he once said, feel that these verbal and public humiliations go in one ear and out the other. Well, they don't. They go in one ear and go straight to the nervous system, eating away coordination, self-confidence, and self-respect. That's the same as in medicine. Not only were verbal attacks and humiliations a blow to my psyche, but they affected how others interacted with me. Fellow students I considered friends began to distance themselves from me, despite the fact that they also received similar barrages from time to time. Nurses were also keenly aware of which students received the harshest tongue lashings, and often treated those students more harshly as well. Nurses mocked me often, and I regularly saw them rolling their eyes when I tried to talk to them about a patient. But worst of all, the berating often occurred in front of patients and their family members. It was uncomfortable for them, but also eroded their trust in me as I tried to care for them. Often, it even eroded their trust in the attending physician, whose behavior they found dissatisfying. No wonder studies show a worsening of the public's trust in doctors over the last few decades. Doctors live in an antagonistic dichotomy. They need a thick skin, but a soft heart, a sharp mind amidst extreme fatigue, a compassionate soul with a firm demeanor, and complete selflessness at the expense of mental and physical health. The messages medical students get are harsh. Don't be weak. Dedicate yourself to the care of the patient at all costs. Don't question your attending. Ignore the fact that you don't get to eat or sleep. And remember that leaving the hospital is abandoning your patient. Don't do too little because you need to rule out all the scary diseases, but don't do more than necessary because over-testing and over-treating is also harmful to patients. See patients more quickly to maximize billing and revenue, but don't skimp on your time with them because they need to give us good satisfaction scores. Make sure you get good marks on your quality measures, but don't ignore all the other aspects of caring for your patient just to focus on those metrics. Follow this treatment protocol to a T, but personalize your care. Even the brightest and strongest don't stand up well to such contradictory expectations. Roughly one doctor takes their life every day, a rate over twice that of other professions. While I don't personally know a physician who has died by suicide, I know at least a couple who came very close. I know several physicians who planned on dedicating their career to the underserved, only to change their mind to a much more lucrative specialty in practice because of a self-admitted loss of purpose. I know physicians who sat in the hospital parking lot and cried from fear of starting another day. A vast majority of, if not all, physicians have had patients violently threaten them. Not every physician gets sued, nearly every physician gets sued, most often for an unfortunate outcome that is not the result of any wrongdoing or neglect by the doctor. Thousands of physicians are burning out and leaving medicine every year, having lost whatever charity and desires to do good that they previously had. Medicine is a jealous mistress, a bit like selling your soul for the opportunity to kill yourself off. Now, not every attending was cruel, not every nurse condescending, and not every student secretly smiled when you looked bad, but there were enough of them to leave a significant mark. I was well beyond the point of using these chips on my shoulder to motivate myself. I did my best, but the motivation to excel had substantially abated. This isn't what I thought being a physician was all about.
Wow, that is... Yeah, I read that the first time, and then I read that section when he sent it over the other day, and it still, brings me back. And I know a lot of physicians and a lot of people who were going to be watching this or listening to this, it brings them back too. And it's, how hard was that to write? I mean, that had to be tough to write.
It was, yeah. And it's funny because I feel like looking back, I saw a lot of signs that I didn't even see at the time that I thought, boy, this was actually probably a lot worse than I realized at the time. Obviously I was struggling and I'm going through all this. And then looking back at some of the things, and I think, I can't believe that actually happened. And, I share a number of stories of attending physicians and their, pimping or berating me and others. And other experiences that I had that left that negative impact. But sometimes I still can't believe they actually happened. And I apologize to those of you who it may bring up those memories that were difficult, because this is something that I think nearly all of us experienced on some level or another.
And it's not just physician training. I mean, a lot of medical professionals. I've seen a lot of nursing literature, nursing social media. Other health professionals, kind of have this. I hate to say it, like tradition of just this way that they train their trainees, and it is just it's just not right how it has happened and how it's still happening now.
Yeah, and it's fascinating that we've done this for so long, and part of it, the more I've thought about it, even after finishing the book, the more I think I recognize that some of that behavior, that negative behavior that has come from some attendings over the years, actually comes from them dealing with these exact same problems, and they don't know how to deal with it, and this is the way it comes out. And whether that's mental illness or burnout or immense frustration, I think that's a lot of where these experiences come from, is them struggling with it themselves. And so I think that even highlights the point even more of how we need to have each other's backs. We need to work together with this. We need to find help when we need to. And it's okay. If you're feeling this, you are not the only one.
Hmm. And you talk about in the book as well, I mean, a lot of detail, which I appreciate and a lot of other people appreciate. You do talk about therapy, you do talk about medication, but talk a little bit about, your wife and your family and how were they part of your way through all of this?
They have been a huge part in helping me get through it. I I wonder if I would be here today without my wife and my kids, just because they helped me so much to diffuse some of those emotions that I would experience. My wife also struggled at times that I go into in the book because she was raising kids almost alone a lot of the time. Um, and she had some of her own issues with depression from time to time. Um, I think having kids, so we had our first child in undergrad, and then one in med school, one in residency, and one in practice. So one kind of all along the line. And so we had very young children. We had babies during these experiences. But in many ways, that helped me kind of step away from medicine when I came home, which, obviously is needed. And no matter where you get that from. And so when you come home and you have a toddler, you're automatically in their world. They don't care what happened today. And they don't care any of the stresses that you've faced. And so if you kind of allow yourself to enter that world, and even if it's not kids, if you treat your home that, okay, this is a different world, uh, it allows you to get away from it and kind of process those emotions and thoughts a little bit better. So, obviously being a parent, being married, there are their own challenges and difficulties, but in my case, they really have been lifesavers.
Right, exactly. Yeah, and also in the book as well, and I've heard you on other podcasts and other interviews as well. Share about your faith
Hmm.
and how your faith has really helped you through this. Can you
Hmm.
can you share with us a little bit how your faith has guided you through this?
Yeah. Faith has always been a very important thing to me. Um, I am currently very active in the Church of Jesus Christ of Latter-day Saints, and have been my whole life. I served a 2-year mission for the church in Ukraine, which, as you can imagine, is a totally different world, which was both good and bad, I think. um, but a lot there have been times where my religion and my faith was a negative for me, and there have been times where it's been a positive. And looking back, a lot of the times it was a negative was more a misinterpretation of doctrine, where I expected myself to be perfect, or I thought others expected me to be perfect. And that was definitely a negative for me, and for so many people. But then when I would take a step back and kind of accept and acknowledge what my faith truly was, and having those experiences that I've had, it ended up being a great strength. And it's hard because a lot of people who are faithful in whatever way, whatever denomination, or very spiritual, um, a lot of them struggle with having mental illness because it seems like there's an added level of stigma. It's that you're not faithful enough, or you're not praying enough, um, and that's just not true. And it that belief or interpretation really can make things a lot worse. Um, Whereas if you accept it for what it is and recognize that you're not perfect, and that's okay, it really can be a strength to you.
Right, right, right. Um, and I do think that you talk about it in the book as well. Kind of the origins of your diagnosis or the origins of your symptoms. Was that in undergraduate level? Was that in medical school? When did that all start to happen?
So I was officially diagnosed with severe anxiety as an undergrad student, and so had treatment with therapy and medication for a while. The depression came on during my intern year, kind of the stresses of everything kind of all combined to induce severe depression. But then looking back in the process of writing the book, I realized how many signs there were growing up. Now, I don't think I had a diagnosable illness as a child or anything, but looking at certain signs, I thought, boy, I really did struggle with certain things that kind of kept building on each other. And then it kind of built to a point as an undergrad student when I had a really bad panic attack, and I didn't recognize it as such. I thought I was having heart problems. So went to the doctor and said, I don't think it's your heart. I think you're struggling with something else. And then it was like a light bulb went off. Oh, of course. That makes so much sense, and all the pieces fit together. And so
what was that hard to face? Were you like, there's got to be something physical? It can't be anything mental illness wise. I mean, was that a stigma for you that you had to face?
No, it wasn't. And I don't know why. I don't have any good reason for that. It was just kind of a relief, like, oh, okay, well, now I know what's going on. And, I've struggled with this for so long, just not recognizing what it was. Maybe now I can try to work through it or, get it in a controllable manner. And, immediately shared with my family and said, I was diagnosed with this, and, I'm going to start this medicine and therapy. And actually that kind of opened the door for certain family members and friends to say, actually, you know what? That sounds very familiar to what I've experienced. Maybe I should look into this more too. But for whatever reason, it never bothered me. I never had much of a self-stigma.
Mm-hmm. Mm-hmm. And, is that something that, that you had to disclose to your employer, or did they know what was going on, or did they know that you were going to be writing the book? I mean, were they very receptive to that, or what was their response to that?
Coming to start the book, I'm kind of one where I jump in feet first and then look around to see, well, should I have done that? But I did go to, my boss and like the legal department and risk management, and, kind of went to all different areas of the University of Utah and said, this is what I'm doing. I explore both good and negative things throughout my experiences. And is this okay? And they basically said, make an explicit statement that we're not involved, and then you're fine. Then we don't care what happens. Right. So, they had to help me craft the wording and everything and make it in there. But thankfully it was, you have academic freedom. You can do this if you want to. We just want to make sure it's separate from the university.
And I know in some states that there has to be some kind of disclosure, like for your medical license. Is that the case in Utah where you have to disclose whether you're receiving, mental illness treatments or anything like that at all? Or
you do have to say, it's kind of one of the broad questions where if you're being treated for or if you have either a medical or psychiatric condition that could disrupt your work or, cause you to harm patients, you have to disclose that. However, if it's controlled and, whether you're on medication or whatever, if the condition is controlled, then you don't need to disclose that. And, that I know, kind of like you say, in some states, the way it's worded can be very problematic. And a lot of physicians won't admit to anything or seek treatment because of the way those questions are worded. That's right. And, my thought on that has always been, you're much more likely to get in trouble with the medical board if you have untreated mental illness than if you have treated mental illness. Only because if you have depression or anxiety or substance abuse or whatever it is, and you're not being treated, you are much more likely to make mistakes and to have harmful interactions with patients. And so in my mind, it's always been, I'm going to be honest about it, because the opposite is going to cause much more problems.
Yeah, exactly. My guest is Dr. Kyle Bradford Jones, author of the book Fallible, a memoir of a young physician's struggle with mental illness. And the internets, which I know is always correct, they say that if you go to the Amazon and you are a Kindle user, there is a very significant good price for this right now, exclusive to this podcast.
Exclusive. Okay, not really exclusive, but we'll
no, not really, but it sounds good though.
But yeah, 99 cents for a Kindle version. It's through Thursday, so go get your copy. And if you prefer the paperback, that's fine. That's $20.95, but the Kindle version, 99 cents for the next few days. I would encourage you, if you want to buy the paperback version, to go to indiebound.org, because they can help you find your local independent bookstore and order it through them. It's the same price. It's not more expensive than Amazon or any other place, but I would encourage you to go there. So indiebound.org to order through your local independent bookstore.
Yeah, and I pre-ordered through, I think this is your publisher, Black Rose Writing. Is that right?
Yes, correct. You can also get it through them. My website is kylebradfordjones.com. Trust me, everything you need to get the book is there. And also, I am able to get a significant discount for residency programs or medical schools when you buy it in bulk for students or residents. So
great.
You can reach out to me and I can help you get with a big discount there.
Cool. Well, let's kind of shift into our last section. I always want to try to leave my audience just with kind of proactive steps and things that they can do and things that they can, kind of recognize. Because I know that's one of the things that you really want to do with sharing your story and sharing your book. And let me just kind of frame it from a standpoint of a medical student and a resident. And in medical education, what are like some signs and symptoms, or what are some things that medical students and residents should really think about and say, hey, maybe I should talk to somebody about this. Maybe there's something that's going on that I need to get evaluated.
Honestly, I would recommend therapy for everybody, especially students and residents, whether you feel like you're struggling right now or not. I think that's a very important thing, because obviously we don't want to wait till this becomes a problem. But like we have our physical PPE right now with COVID, we want to have our emotional PPE as well to keep us safe. Signs to watch for, obviously there's the classic signs of depression and anxiety that we are all familiar with as physicians. But other things like being anxious no matter what. Like I had a really hard time on days off because I felt like I was missing out on work, or there was things I was supposed to do, or this is my one day for the next couple of weeks off. I need to make sure I take advantage of this. And so that was kind of a big thing for me, is things would be going great and I would be incredibly anxious or depressed. Another thing that you can notice from faculty or attending or preceptor perspective is if the student or resident, starts to not respond to emails or texts or different things as quickly as they used to. That seems to be an early sign. Honestly, I feel like just asking residents and students, how's your mental wellness right now? I have tried to make that more of a habit, and you'd be amazed how much they're willing to open up and say, boy, yeah, I'm struggling with this and this and this. And I had a resident just the other day who was in clinic, but had been in the hospital in the morning and left and said, I just had such a hard morning. I just wanted to sit down and cry. And, you know, even just taking a few minutes to kind of explore that and let them talk about it, that's incredibly helpful.
I had a train of thought and I lost it. So I guess, I mean, you know, one of your roles in the residency program too is just to kind of check in with residents, you know, and you know, what does that look like? Is it just say, you know, do you see them in clinic, or you just say, or you just check in with them when you're doing like a educational program or something like that, and saying, hey, how's it going?
You know, most of the time my interaction with them is in clinic. And so you know, and there will be anywhere from 1 to 4 residents that I'm working with that day. And so I will try to, if I see a moment where it's a little calmer, or the others are seeing patients and it's me and one resident, I will try to ask and just see how they're doing. I also am a dedicated advisor for a couple of residents, and so that's certainly much more of a in-depth and regular check-in with them to make sure that they're doing okay. You know, I had a resident advisee that in the last couple of years was really struggling and ended up leaving medicine. And you know, I think I don't know how much from his perspective it was helpful with me and my experience, but I think it helped me to understand a lot more where he was coming from in trying to help him work through some of the issues. So yeah, you know, mostly it's kind of an informal, when they're in clinic and there's a quiet moment, and I'll ask them.
And the stigma is still huge out there. I mean, there's a stigma in society with mental illness. And then within that, you know, there's the stigma in the medical community and the physician community. I mean, obviously, is that one of the goals with sharing your story, to trying to break through some of that and to try to overcome the stigma that's out there?
Absolutely. Because, you know, as I'm sure most of the listeners, if not all, we know the suicide rate of physicians is much higher than in the general public. And we face a lot of very unique stressors that other professions or other individuals don't face in the same way. And so our rates of mental illness are going up quite significantly. And I want physicians and students and residents and everyone to know that, you know what, it's okay to get help. In fact, it's better if you do, instead of leaving it alone. And you know, you can still have a successful personal life and professional life and whatnot with getting the help that you need. So absolutely, that's probably the biggest goal of the book, is to try to decrease that stigma and help people understand you are not alone, and that's okay.
You know, and other things too that I've heard you talk about before. I mean, you know, obviously there's other solutions that we can work on, and you've talked a little bit about things maybe that can be done with medical education, other than just checking in with the residents, or other things that you can see that maybe even a possibility in medical education to try to, you know, change this really bad tradition we have of you know, just berating our trainees.
Yeah, I think there's kind of, it's hard because there's a way to approach it from a personal level, from an educational systemic level, from a healthcare systemic level, all these different perspectives that really play into it. You know, I think one of the things is that I don't know how many else experienced this. I think a lot of us did, where in medical school, I was kind of told it's really hard to be a physician. You're going to face tough things and death and ethical dilemmas and all this stuff. So you better figure out some way to handle that. And instead of like, no, here are some tools that you can use to deal with death or all the time, or to deal with people suffering, or the inability for you to fix all their problems. And so that's really a big thing. I think, really being able to work on just sticking up for one another and being kind. It's hard because as a student and as a resident, like, it can be pretty cutthroat, and sometimes where I think especially as a student, where you want to get the good residency, you want to get the good research project or whatever it is. We just need to be supportive and be kind of one another, and especially as attendings to do that. But also, as we know, like, there are so many healthcare systemic factors that are contributing with EMRs and prior auths and
regulations and all that stuff.
It's so hard, and it's something, I mean, everybody listening understands that. We have all experienced that, and it's a huge frustration. And, I think that's one of the biggest reasons why it's growing, becoming a bigger issue of mental illness. Our profession has had a higher suicide rate than the general population for over 100 years. Like, this isn't new. We've just never been taught how to deal with it and how to fix it from these different perspectives. And we really have to focus on this. I mean, we are causing great harm to our physicians and other medical personnel, and ultimately to our patients and to our society as a whole.
Yeah, there was I think it was a podcast or an interview or something like that I heard that, and you do talk about it in the book as well, as there was a time where it was really kind of a low time, and where you kind of quote, lost your humanity, or you felt like you'd lost your faith, or not faith, but just not really feeling like you're really making a difference. And that was really of a powerful thing. And have you found your way back to I guess, having some faith in humanity again, or that you're making a difference with your patients, or with the work you're doing right now?
So one of the lines I kind of described in that section was that I wasn't sure. So taking this job, working with this underserved population that can be hard to care for, I wasn't sure if that was a sign that I still had my humanity, or that I was really trying to get it back. And recently, talking with my therapist, and I shared that line with her, and she said, "Well, I think you have your answer. Like, you're still there." And I think I have gained it back. I do feel fulfilled, and that I am making a difference. And sometimes it's hard to see that, because you don't see the immediate response, especially in primary care, where it's not like a surgeon where you go in and you take out the appendix and, save their life. There you go. We save just as many, if not more, lives as other specialists, but we don't always see it in such a dramatic way. And so working with this population and trying to find better ways for us to care for them, and to, and doing some research to try to expand the knowledge that we have of them, of how to care for them, but then also working with students and residents and helping them through their experiences. I do feel as if, whether I never lost it or I gained it back, I don't know, but I feel like I have some humanity now.
Yeah. Something that really, one of the many things that resonated with me in the book, and I wasn't going to go here, but I'm going to go here anyway. Like, you talk about self-confidence and the lack of self-confidence. I've definitely very much resonate with that, and struggling with that feeling every day. It's, am I good enough, and do I deserve to be here, and are they going to take away my medical degree, and the whole imposter syndrome type of thing. And that's something that I struggle with every day. But reading that section, or reading those sections in the book, and hearing you talk about that in other interviews, that's something that really resonates with me, and it's something that I kind of struggle with a lot. And I'm glad I'm not alone, I guess is what I want to say. And you probably hear that a lot from people, and say, "Hey, I feel that too, and I've been through something like that in the past."
Yeah, absolutely. And whether it's that specifically or other experiences or things, absolutely, I do I think the majority of people I've heard back from who have read it, they connect with it in some way, or it resonates with them. And I think, again, that just kind of underlines, this is a common experience, not only in medical education, but across society, with individuals who are dealing with depression or anxiety. And that rate is dramatically growing in society, based largely right now on COVID. But even before then, it was growing. And, I hope lots more people find that connection.
My guest has been Dr. Kyle Bradford Jones, author of the book Fallible, a memoir of a young physician's struggle with mental illness. And Kyle, I will let you share some closing thoughts in just a little bit. I'm going to share some closing thoughts from myself, just from our conversation, and just want to let everybody know that, mental illness is just, it's a tough thing in the general population. It's a tough thing with medical professionals and also with physicians. And, what I'm hoping to share with this story is that if you're suffering like this, you're not alone out there. And if you feel like you're having issues, if you feel like you're having a problem, reach out to a friend, reach out to your family, reach out to your family physician. We're here for you. We can connect you with the right resources. This is a great book right here, a great first-person perspective. Even if you're not in medicine, I encourage you to read it. I encourage you to give it out to people, maybe even who are thinking about medicine or the medical profession. I think it is a great thing just to kind of get you inside. A lot of everybody loves kind of behind the scenes type of books and stories. This is when they're going to get you there. If for anything else, to help you recognize, hey, maybe I need to talk to my family doctor about some of these symptoms so I can get help for myself, especially in this time of COVID-19. And I know I have a lot of patients with financial difficulties. There's always work and stress problems out there. So reach out to your family physician. That's kind of my take home for for this conversation tonight. So Kyle, I'll bring you back in here. You have any closing thoughts for our audience, and anything else about the book that I didn't ask you about you want to share this evening?
Well, thank you for those thoughts and comments. I completely agree. If you are struggling, talk to somebody. And honestly, if it's a friend or a loved one, or you need a therapist, or you call the crisis line and just say, hey, I'm struggling a little bit right now, or go talk to your physician. Those are all good things for you to do, because if we keep it buried inside, there is no good that's going to come from that. And so, you are not alone. There is a lot of positive things that can come from getting treatment when you have a condition like this, and that's okay. Like I said earlier, if you are a part of a residency or medical school, I can get you a discount for buying in bulk, or you can go to my website, kylebradfordjones.com, and has links to all the different places where you can get the book. If you like Kindle, 99 cents for the next few days. And also, if you're interested in the paperback version, I'd encourage you to go to indiebound.org to find out how to order it through your local independent bookstore. And there are links to all of that on my website. But I hope everyone finds both this useful and the book, and hopefully you can be someone that can help others out as well when they may be struggling.
Great. I guess the final thing is, where else can people find you out there on the internets?
So I'm on Twitter and Instagram, and my Facebook page. All of them are at kbjones11. Any of those, this Facebook page is a professional one, as opposed to my personal account. But I'm happy to interact with anybody or whatnot on any of those. So please connect with me. I'd be happy to connect.
Cool. The book is Fallible, a memoir of a young physician's struggle with mental illness. My guest has been Dr. Kyle Bradford Jones. Thank you so much. This has been fun. We'll bring you back. Best of luck with the book.
Thanks, Mike. I appreciate that.
And that ends our short, bite-sized 60-minute episode tonight. But go to ohioafp.org. You can see more of our episodes, more of our chats with family docs. I hope to bring you more conversations and stories from family physicians very soon. So good night, everybody.
Good night. Thank you.